and we are based in a family clinic, which is a multi-speciality clinic in Derabasi, which is right next to Chandigarh. So today we'll be starting our discussion on diarrhea, the causes and the treatment in children. So diarrhea in children is मोस्टली इन्फेक्टिव इन नेचर, जो किसी ना किसी इन्फेक्शन की वजह से बच्चों में होता है. 70 to 80% ऑफ द इन्फेक्शंस आर ऑफ वायरल नेचर. तो इनके अंदर मोस्टली कुछ वायरसेस हैं, स्पेसिफिक वायरसेस हैं जो बच्चों के अंदर डायरिया बहुत ज्यादा करते हैं. टॉकिंग अबाउट कि इनके क्या साइंस हैं, क्या सिम्टम्स हैं, हम कब कहेंगे बच्चे को डायरिया है, हमें क्या क्या रेड फ्लैग्स मॉनिटर करने हैं, और एक छोटा सा एस्पेक्ट कि बच्चे के डायरिया मैनेजमेंट में हमें किस किस चीज पे ध्यान देना है, आज हम उस पर बात करेंगे. तो टॉकिंग अबाउट कि डायरिया है क्या. डायरिया इज बेसिकली जब हमारा बच्चा अनफॉर्म्ड वाटरी लूज स्टूल करे, उसको हम डायरिया डिफाइन करते हैं. पेरेंट्स बहुत एप्रीहेंसिव होते हैं कि कभी कभी सिर्फ कंसिस्टेंसी चेंज हो रही है, कभी कभी बच्चा पानी जैसी लैट्रिन नहीं कर रहा है, बट द स्टूल की कंसिस्टेंसी इज चेंजिंग. दैट इज नॉट कंसिडर्ड डायरिया इन मेडिकल टर्मिनोलॉजी. पैसेज ऑफ लूज watery stool which might or might not be affected with passage of blood or mucus is defined as diarrhea. डायरिया मोस्टली वायरल इटियोलॉजी का सबसे ज्यादा कॉमन है इस एज ग्रुप के अंदर, and depending upon the severity of the disease, the diarrhea can be manifested as watery loose stools, which may be present even 2 to 3 times a day, and it can be very high purge rate diarrhea, जिसके अंदर जो डायरिया के एपिसोड्स हैं, that they might be as high as 10 to 12 episodes of diarrhea. डायरिया की वजह से बेबीज को associated vomitings, slight amount of gastritis, excessive flatulence is also associated with diarrhea sometimes. And इसके साथ साथ there is sometimes passage of blood या mucoid या mucus discharge in the diarrhea as well. So diarrhea basically in nutshell is again the same thing, viral या हमारा बैक्टीरियल. इन बच्चों के अंदर हमें ध्यान क्या देना है. इन चिल्ड्रन जो जिनको डायरिया है, हम बहुत ज्यादा मेडिसिन देना अवॉइड करते हैं. वी विल नॉट प्रेफर गिविंग एनी मेडिसिन विच विल स्टॉप द डायरिया इमीडिएटली. तो जो ओवर द काउंटर्स लोपेरामाइड एंड ऐसी ड्रग्स हैं, वो हम बच्चों में नहीं देंगे. एक बेसिक सी किट हम डायरिया मैनेजमेंट की अपने बच्चों के लिए घर में तैयार कर सकते हैं, which would consist of oral rehydration solutions. हमारे पास दोनों तरह के oral rehydration solutions आते हैं. The solutions which are made in packets, जो पाउडर फॉर्म में होते हैं, जिनको हम 1 लीटर वाटर के अंदर मिक्स करके बच्चों को दे सकते हैं, या हमारे पास टेट्रा पैक फ्लेवर्ड ORS भी आते हैं. तो in diarrhea management there are some things that we need to understand in seeing the severity of diarrhea. सबसे ज्यादा जरूरी बात यह है कि अगर हमारा बच्चा लूज मोशंस और वॉमिटिंग्स दोनों कर रहा है, दोनों केसेस के अंदर वी हैव टू बी वेरी स्पेसिफिक कि हमारा बच्चा डिहाइड्रेट ना हो. तो हम डिहाइड्रेशन को मॉनिटर कैसे कर सकते हैं. चिल्ड्रन विल गेट डिहाइड्रेटेड इफ दे टेंड टू पास मोर देन 5 to 6 एपिसोड्स ऑफ डायरिया, और इसको हम प्रिवेंट भी करेंगे, और इसको हम जो बच्चे को पानी का लॉस है उसको हम ठीक भी करेंगे. तो इसके अंदर मेन स्टे ऑफ ट्रीटमेंट इज ओरल रिहाइड्रेशन थेरेपी, जो हम ORS बच्चे को पिलाते हैं. रफ एस्टिमेट से whatever is your baby's weight, for example if our baby's weight is 10 kilograms, for every loose stool that a baby will pass, he will require 100 ml of ORS to be replaced. Similarly, अगर हमारे बच्चे का weight 20 kg है, he will require 200 ml of ORS after each loose stool. We have to keep them hydrated ताकि बच्चों को dehydration ना हो. But just in case अगर dehydration हो भी जाती है, we will still have to monitor कि बच्चे को dehydration कितनी severe है. Severity of dehydration को assess करने के लिए we can look into 4 parameters. क्या baby stool के साथ या loose stool के साथ every time he is passing frequent urine, So our babies who have diarrhea should pass urine every 6 hours. अगर 6 घंटे में यूरिन अच्छा नहीं पास हो रहा है, देन इट इज अ साइन कि हमारा बेबी डिहाइड्रेट हो सकता है. सेकेंडली, द टंग एंड द आईज वुड स्टार्ट बिकमिंग ड्राई, क्योंकि पानी शरीर से जब निकलेगा उसकी वजह से दोनों चीजें ड्राई होने लगेंगी. थर्डली, we can see whether our baby is active, irritable, or is very sleepy. Babies in the initial phase of dehydration will be active. They will demand liquids. But as dehydration would worsen, they would again become more drowsy. They would sleep. They will not demand water. Secondly, in diarrhea management, ORS can be given as frequently as the baby passes stool, and उसके साथ we can give them ORS every 2 to 3 hours if he is not passing it, ताकि बच्चा dehydrate ना हो. Over the counter antibiotics are not recommended in routine episodes of diarrhea unless we have frank passage of blood or mucoid discharge from the stool. जो डायरिया के एपिसोड्स हैं, they would continue to occur in the same purge rate, but and gradually they would settle if it is a viral diarrhea. Associated with diarrhea, we might get sometimes vomitings. The baby will start having a rash over the perianal region or from where the potty comes out. So that is to be taken care of as well. Secondly, we can use zinc as a treatment option. We have over the counter preparations of zinc which we can use. Zinc helps in maintaining the normal healing as well as promoting healing from the normal mucosa, और जो lining है हमारे intestines की, उसको healing के अंदर help करता है. So we can use zinc for 14 days, which will help in the recovery of the baby, and we can use probiotics. Probiotics are basically good bacteria which are washed off by any infection in the gut. So that will further lead to more watery diarrhea. Diet also plays a very important role in diarrhea management. Diet wise, most of the problems that we face in pediatric practices, most of our babies are breastfed or milk fed till 6 years of age, 6 months of age, and then they would have milk 2 to 3 times a day till they reach 2 years of age. So we have a very frequent questions which is asked by mother whenever my baby is taking milk or when giving whatever type of milk, either breast feeds or formula milk or cow milk or buffalo milk, the diarrhea increases and there is some amount of rash which increases only after giving milk. So in our babies, जब कभी भी हमारे इंटेस्टाइन में थोड़ी बहुत इन्फेक्शन होगी, देर इज सम अमाउंट ऑफ लैक्टोजन इंटॉलरेंस. जो सबसे ज्यादा शुगर कंटेंट है, विच इज लैक्टोस इन मिल्क, वो बच्चे डाइजेस्ट नहीं कर पाएंगे. वो अनडाइजेस्टेड ही लूज मोशंस के अंदर मिल्क निकल जाएगा, एंड दैट इन द डाइपर will react with the urine and it is broken down into urea, which will cause all redness and rash and skin changes around the perianal region. So diaper dermatitis is very common when we have uh, diarrhea and the babies are milk fed. Diet के अंदर we can avoid in milk. That is one that is going to affect the numbers of diarrhea. अगर हम milk दिन में 3 से 4 बार दे रहे हैं and we bring it down to 1 to 2 times, the diarrhea episodes would decrease eventually. Coming on to what diet should be given in diarrhea, our main goal is to keep the child active, keep him well hydrated, and use more of rice products. आप बच्चे को खिचड़ी दे सकते हैं, दाल चावल दे सकते हैं. You can give him things which are rich in carbohydrate, क्योंकि कार्बोहाइड्रेट हमारे गट से पानी की मूवमेंट को टुवर्ड्स द बॉडी कर देगा, तो उससे डिहाइड्रेशन होने के चांसेस और कम हो जाएंगे. Secondly, we can use curd as a preparation because curd has good bacteria which will again help in decreasing the episode of diarrhea and the severity of diarrhea. Associated with this, we have to take into consideration कि the whole and soul diarrhea episode is not going to stop in a day or two. In case of viral diarrhea, it is going to take 3 to 4 days or up to 7 days for the diarrhea to completely recover. The diarrhea episode would be big. The babies would be passing a huge amount of stool in the initial period. As it improves, as the symptoms go down, the volume of stool would decrease and it will gradually come down to the normal place. So, complete recovery in diarrhea may take place between somewhere around 7 to 14 days. What red flags should be monitored, or how can we monitor when should we visit a doctor in diarrhea? Most of the times, if there is any passage of blood or any passage of mucus or any mucoid discharge from the anal region associated with diarrhea, we need to start antibiotics, and we also need to see whether the diarrhea episode is secondary to a bacterial infection in the intestines or in the abdomen. So, this is one way where we need to start antibiotics. Number two, all the red flags in diarrhea are associated with the dehydration that our baby develops. So, if our baby is feeding every 4 to 6 hours, if he's passing urine every 4 to 6 hours, his oral intake is fair, and he is taking plenty of oral liquids, we will not be worried about the diarrhea if he has 10 or 12 episodes as well. We just have to make sure that we are providing our babies oral rehydration with ORS. They are having plenty of oral liquids. They are having curd. They are having rice based products that are easily digestible. And we will just continue to monitor the episodes of dehydration by assessing ki, whether the baby is drinking water, whether hamara mouth and eyes are dry, and whether the baby is active or he is very irritable. Sometimes the babies would be irritable because of colicky abdominal pain, or it can be because of the rash that they develop during the diarrhea episode. So we need to again watch for the rash. Now, a very frequent question that we get in diarrhea management is that initially the diarrhea was watery, and now there is some amount of semi digested food that is coming out. Every time the baby eats something, he's going to poop out something, but now it is not watery. So, whenever there is diarrhea, our intestines would run faster, and every time some food would come out. This is called exaggerated gastrocolic reflux in babies. So, you need not worry about it. The severity, the amount, and the number and frequency of diarrhea would gradually come down. Thirdly, the most questions that we are asked about diarrhea is what all medicines can we use for diarrhea? So we can make a kit at home, and we can keep these medicines at home whenever a diarrhea episode starts. We can keep these things handy. We can have a paracetamol at home. We can have sachets or packs of probiotics. We can have zinc at home, and we can have ORS at home. So these are four medications which are most commonly used in diarrhea management at home and home-based remedy. One problem that most of the parents would feel it that the baby is not liking the flavor of ORS, or he's not having the amount of quantity that is desirous for the baby to take ORS. So the only way out of this is that we have to keep feeding the baby in small aliquots. हम बेबी को 5-10 ml हर 2 मिनट में 4 मिनट में कटोरी चम्मच से ORS पिला सकते हैं. धीरे धीरे we can act and we can give the baby ORS. So that way dehydration can be prevented in babies. So this is about diarrhea and management. If the diarrhea episodes last more than 14 days, or the diarrhea is if the diarrhea is progressing for more than 14 days, then we need to see what are the other causes of chronic diarrhea in babies, which can be because of malabsorptions, which can be because of celiac disease, which can be again associated with any bowel involvement. So any diarrhea which is persisting for more than 14 days is something for which you should visit the doctor. So These are the most common causes of diarrhea. So we have a question from Madhvi about cholera, that what are the causes of diarrhea? Please suggest some home remedies about to cure toddlers. So the home remedies that we know is something that the remedies we've already talked about: a good diet, more carbohydrates, more rice, and oral rehydration still being a home based therapy. For cholera management, the basic management would remain the same, but cholera incidence in India is decreasing, and we need to start antibiotics. Over the counter antibiotics in diarrhea are not indicated. In cholera, you would get large amounts of diarrhea, which is associated with severe dehydration. For cholera, we need to start antibiotics, and we can do it later. We also have one question from Mr. Saurabh about should we give antibiotics in diarrhea? Routinely, diarrhea episodes in children are primarily viral in nature, so antibiotics do not play any role in improvement of symptoms or the duration of illness. Antibiotics are only indicated in scenarios where we feel there is a bacterial contamination, when the baby is exposed to foods which are uncooked, or when there is passage of mucus or blood in the stool. And we have one question from Anjali that what should be avoided in diarrhea? So again, our main goal is to promote more oral liquids, keeping hydration normal. Milk to some extent can be avoided because it will again cause more diarrhea secondary to lactose intolerance. And we can use more of rice products, khichdi, dal, chawal, and things which are easily digestible. Over the counter drugs should be avoided. Loperamide and other drugs which would eventually stop diarrhea should be avoided. We have one question from Vasundhara asking for how long can diarrhea last. So in most of the cases, the diarrhea episode would last for 7 to 10 days, and it would eventually be normal in within 14 days time, like any viral illness. Initially, your baby would develop diarrhea episodes for 3 to 4 days, where they would as high as 10 to 15 episodes of diarrhea, and it would eventually come down. The bulk of diarrhea or the whole purge of diarrhea would gradually come down, and then the number would decrease. Yes. So we have one question from Ashi who's asking that we have vaccines for diarrhea, and which is rotavirus vaccine. Yes, Ashi, we do have vaccines for diarrhea. Rotavirus and norovirus are two viruses which are very, very severe in causing gastroenteritis in babies. But again, these vaccines would not prevent diarrhea episode, but they would prevent our babies from getting severe diarrhea and dehydration. So over the vaccine, rotavirus vaccine is available in our primary schedule, and for that primary schedule, we will give 3 doses of rotavirus, the first dose at 6 weeks, the second at 10 weeks, and again at 14 weeks. So we have different brands of rotavirus vaccination available. The vaccination schedule is different, so we can cover that up in vaccinations as well. But this is only against one virus, which is the rotavirus. And why we are giving vaccinations is because it causes most amount of dehydration, the most amount of hospitalization secondary to diarrhea in babies. So yes, rotavirus vaccination is one vaccination which can be taken as part of implementation. Most of the states are covering rotavirus diarrhea in their primary schedule as well. So we have one question from Manya, who's asking, is it possible to get diarrhea for 6-month-old baby? Is it because of the eating stuff? See, 6 months old baby, 7 months old baby would develop diarrhea episodes, but that are not primarily dependent upon their eating stuff, but because of their habit of teething. So 6 महीने पे जब हमारे दांत निकलेंगे, there is a huge amount of hand to mouth habit that the baby goes through, और उसकी वजह से there will be some amount of infection that is going to happen. At 6 months, when we start feeding the baby something, for the first 6 months, the baby is completely breastfed. And when we start on complementary feeding, then there are chances that the consistency of stool might change, the frequency and number of stool might change. But clear cut definition of diarrhea is passage of watery, unformed stools. And we have one question from Karishma, that I have a 1 year old child who's suffering from diarrhea for the last 4 days. Should I give him Glucon D for him? Karishma, Glucon D is a very good source of glucose, but it lacks all the electrolytes that is required. For each episode of diarrhea that the baby has, there is loss of salt, there is salt or loss of potassium, there is loss of bicarbonate. Glucon D contains only and only glucose, which does not help in recovering or uh, in improving the diarrhea. So rather than giving Glucon D, you can use ORS, which contains most of the electrolytes that are used in this. And so this would end our session on diarrhea and its management in children. And you can follow us on Baby Chakra for all our upcoming articles and our live chat. And so if you have any more queries, we are more than happy to help you on Baby Chakra as well. And if you have children that you who need medical attention, you can visit us at Family Clinic, which is based on Barwala Road, Derabasi. And the easiest way to reach that place is it's just next to ATS Society, which is on the Barbala Road in Derabasi itself. Thank you so much for being on my live chat.